Hello, everyone. Welcome to your lecture on loss and grief. These are the learning objectives that we will cover. Oops, sorry, going too fast here. So what is loss, first of all, right? And what are the different types of loss that we see? We have necessary loss, something that's expected, right? Death of a loved one, divorce. These are kind of expected in life, right? Maturational loss, a form of necessary loss that includes, all normally expected life changes across your lifespan. For example, separation anxiety that the toddler feels from a parent when they start preschool. So this is maturational. As you mature, you experience loss. That's part of life, right? Situational loss, it's sudden and unpredictable. Right? For example, one day, your family member is fine. Next day, they were in an automobile accident and they lose functioning or you lose functioning, right? Those are situational losses caused by situations. Actual loss is where a person can no longer feel, hear, see, or know a person or object. For example, the death of a family member, right? You lose them and then you don't get to see them again. Right? Perceived loss is uniquely defined by the person's experiencing the loss and is less obvious to other people. Right? For example, a person perceives rejection by a friend to be a loss, right? Which creates a loss of confidence or changes in their status or social group. So they're perceiving that loss, right? It might not be a valid loss. It might be something else, but that's what they perceive as a loss. So it's always important to remember that every person responds to loss differently. Just because, we have certain ways of responding to loss doesn't mean everybody else will do it that way, right? Some people, the loss of an object might cause the same distress as the loss of a person, right? And there's no judgment over there, right? That's their level of feeling of loss. Chronic illnesses, disabilities, hospitalizations, they produce multiple losses, right? And so we have to look at it holistically. Death is the ultimate loss, right? Culture, spirituality, beliefs, values, previous experiences of loss, they all influence the depth and the duration of the grief that a person experiences and responds to, right? Loss is universal and incontestable event of human experience. In life, we're going to have loss, right? That's a fact of life. Events of loss can cause grief and the process called bereavement or mourning. So when they have loss, they're in grief and they are bereaving or they're mourning. So what is grief? This is an individual's response to the loss that is perceived, real or anticipated, by the person experiencing the loss, right? It is a complex experience one feels emotionally, cognitively, physically, socially, and spiritually. Now, this is the definition of grief. It's very, very individualistic, right? Very customized to the person, right? These are some definitions down here: mourning and bereavement. The ways in which an individual outwardly expresses grief, right? Bereavement is the time of sadness after a person experiences the significant loss through death, right? So there are different types of grief, just like loss. We have normal, uncomplicated, a common universal reaction, Then we have anticipatory. That's grief that occurs before the actual loss or death. So you're anticipating something is going to happen, right? For example, if your family member has a terminal illness, you're perceiving that they're going to go soon. So it's anticipatory, right? Disenfranchised, when the relationship to the deceased person is not socially sanctioned. So they can't share it openly, So it seems, seems like they have lesser significance, right? Ambiguous grief is a type of disenfranchised grief. It occurs when the person who is lost is physically present but not psychologically available. This is a case of, for example, severe dementia and brain injury. If you have a family member or parent who has severe dementia, right, it's ambiguous loss, right? They're there, but they're not psychologically available to you. Complicated grief is prolonged or significantly difficult time moving forward after a loss, right? And then chronic is just after you lose a loved one, it extends for a long period of time, right? And then delayed is unusually delayed or postponed because sometimes the loss is really overwhelming and it takes everybody different time, different, span of time to come to a full realization of the loss and how it's going to affect them. Then you have a masked grief, right? This is a survivor is not aware that their behaviors that interfere with normal functioning are a result of loss. So sometimes they'll act a certain way and they don't realize, oh, I'm acting like this because, I'm grieving, right? So these are the different types of grief. Symptoms of grief. What do we see in patients? You see emotions like sorrow, fear, anger, guilt, loneliness, fatigue, helplessness, yearning, relief, right? Sometimes, cognitively, you'll see like disbelief, confusion, memory problems, inability to concentrate or make decisions. Physically, we might see headaches, nausea, appetite disturbances, insomnia, and feeling short of breath, a choking sensation like muscle weakness, this lack of energy. And then behavior-wise, we see crying, like frequent sighing, self-isolation, absent-mindedness, dreams of the deceased, keeping the deceased room intact. Sometimes if it's the loss of a child, parents tend to keep the room intact because it feels like they're still connected to them, right? Loss of interest in regular life events, wearing objects that belong to the deceased. All of these are symptoms that we see in a person going through grief. And it's important to remember that it's a process, right? And everybody has a different way of dealing with this process. It's very personal. It's not predictable. Everybody is different. Most individuals recover adequately within a year after the loss. Some may experience an extension of that process. They might have objects, memories, or anniversary, and then they see that, and then it causes this surge in their feelings of loss. For example, after the loved one dies, it's the day of their birthday, and it just brings that back, right? Grief can diminish, and healing can occur when the pain of loss is less, right? When the pain is less, then they can, heal. So there are different stages of grief. When a person has a loss in life, they lose a person, a family member, maybe somebody very close to them. There are different stages of grief. You have, first of all, is denial. It's difficult for them to accept the fact of the loss. It's a form of psychological protection from a loss that they can't bear. They just don't want to accept it. That's denial. Then they, fall into anger. They become resistant or intense anger at God. Oh, God took, my family loved one away, or other people or the situation, right? For example, if they died because of a car accident, you have this anger at that person who was maybe involved in the car accident, right? Bargaining. Then you get, the person goes to bargaining, where the person cushions and postpones awareness of the loss by trying to prevent it from happening, right? They're like, preventing that, blocking out those feelings, right? They're bargaining, right? So depression is the person realizes the full impact of the loss. Now they have these feelings of sadness and the crying. And then finally we have acceptance. So basically the person incorporates the loss into their life. They learn to adjust and live their life and become functional. So in older adults, how do we see grief in older adults? There's an increased likelihood that they have faced multiple losses because of their age, their long length of life. They must have faced multiple losses. Maybe spouse, then children, then siblings, other family members, cousins, friends. Then a lot of, especially if they live in senior living homes or nursing homes, they have a lot of friends there, right? They make friends there, and then they see them dying. And it just is like one loss after another. It just keeps impacting them, right? Many older adults, they do exhibit resilience, and there's so much we can learn from them because of their experience with it. They're at risk for complicated grieving, and that is because of multiple losses. They don't have as much resources as they used to, and, decreased coping. This can lead to cancer, heart disease, high mortality in this population because they take that stress and they get sick, right? Losses can make them prone to emotional and mental stress, depression, and substance abuse as well. Chronic illness can, leads to grief over lost health, right? Function and roles. So that's the loss of health, right? They can benefit from therapeutic techniques, for example, like positive appraisal, It's basically cognitive restructuring of your, of the cognitive abilities. Basically, for example, if they see a diagnosis, cardiac diagnosis, helping them to look at it as, okay, now this is my opportunity to become healthy. Eat nutrition, exercise, like you're restructuring their feelings, their grief to something that's more beneficial, like, that they can benefit from. Then relieving the depression and maintaining physical function are therapeutic goals for older adults. So what can we do as nurses? Vital signs, they should always be normal for age. If they're abnormal, then that's something you have to follow up on. And assess their ADLs, depression. Use the geriatric depression scale to check their depression, see if they have depression, check for any suicide risk, any feelings of uselessness or hopelessness. Are they isolating themselves? Look at quality of life changes in them, because they might have a family member and then all of a sudden who used to take care of them and now they pass away, they lost them, and it might even financially impact them. Right? So you may have to look for resources for them. Assess for any new or increased alcohol consumption, because that can show that they're depressed, right? And previous experiences with grief and loss, learn about their previous experiences with them, because then the way they handled it in the past, if it worked for them, then maybe we can talk to them about that, right? Any religious affiliation, denomination, ethnic background, and cultural practices are also important. Check available support systems. Maybe they can get grief counseling, encourage past coping skills like we just mentioned, right? So maybe they'll work again and they can use those same coping skills. Encourage them to share their feelings, encourage them to socialize with family and friends and reminisce, about their life experiences. That's very important to engage them. So now let's talk about end-of-life care. So end-of-life care is when care that we provide shifts from invasive interventions that are aimed at prolonging life to a focus on symptom control and comfort, right? Insurance companies normally view the end-of-life stage as 6 months before death, hospice care, right? And during this time, as hospice nurses, they focus on pain management. The patient experiencing pain, manage their pain, skin and oral care, helping them with their breathing, alleviating the dyspnea that they're experiencing, the death rattle, we call it, right? The chain strokes breathing. Then pharmacological and non-pharmacological anxiety management, managing GI symptoms, because the medications are going to make them nauseated, vomiting, their GI is very slow, so, or they can have diarrhea or constipation, gastritis, incontinence, managing all those GI symptoms. And assessing for any psychiatric symptoms like depression and delirium. Recognize their spiritual needs, right? And cultural needs. What would make them feel comfortable. Support family and caregivers. Provide family and caregivers the support and resources they need to be there for their loved one. And then when the patient passes away, then you want to, make sure that you provide bereavement support to the family. So the difference between palliative care versus hospice care, we hear both terms, and sometimes they're used interchangeably, and that's not the case. They cannot be used interchangeably. Palliative care, the focus is prevention, relief, reduction, or soothing of symptoms of disease or disorders throughout the entire course of illness. And that course of illness can be a long time, right? It can be months, it can be days, months, years, however long it is. The goal over here is to help the patient and families achieve best quality of life. This can be used for patients with chronic or terminal illnesses like cancer patients, right? The misconception is that it's only used for patients with a terminal disease, but it can be used actually for both chronic or terminal diseases. Hospice care, the focus is care, comfort, quality of life of a person with a serious illness who is actively approaching the end of life, right? The priority over here is pain, symptom management, comfort, quality of life. Patients usually have less than 6 months to live. It's, and this care can be provided in the home, hospital, extended care, nursing homes. You can have inpatient hospice facilities. It's important to develop, as a nurse, to develop a trusting relationship between, the nursing team, the hospice team, and the patient and family, because that way we, the communication is there and the resources and care is there. So what are some physical changes we see before death? You'll see increased periods of sleeping unresponsiveness, circulatory changes with coolness and color changes in the extremities. As you can notice in this picture, you'll see this, what we call mottling, right? The skin is mottled, right? So you see that because as the circulation is reducing in the peripheral extremities to keep the essential organs alive, right? You'll see that in the nose, fingers, cyanosis, pallor, mottling. Bowel or bladder incontinence, decreased urine output, or very dark colored urine. You might see restlessness, confusion, disorientation. They might not be interested in eating or drinking, or they might lose the ability to swallow, right? Then we have congestion, increased pulmonary secretions, noisy respiration like the death rattle, right? Then you have altered breathing like apnea, labored or irregular breathing like chain strokes, we call it Cheyne-Stokes pattern, decreased muscle tone, relaxed jaw muscles, sagging mouth, weakness and fatigue. So these are all signs that we see just before the person dies. So what can we do as nurses for, in this case, we can administer their medications as ordered, like morphine, benzodiazepines, whatever is ordered for them to keep them comfortable, keep their skin clean, dry, and moisturized, because they might have incontinence, so make sure they're clean. I mean, they're already dying and we don't need to give them a pressure injury, so provide oral care for at least every 2 to 4 hours. Apply, maybe give them like a balm on their lip to prevent the dryness. Topical analgesics to oral lesions if they have oral lesions, and a lot of times they do develop those, right? Then we want to use optical lubricants or artificial tears to reduce the corneal drying, because the corneal area is going to dry and it could be very uncomfortable. Provide periods of rest, educate the patient and family about energy conservation, help them to conserve the energy. Provide the opportunity for patients to express feelings through active listening. Give them that chance to talk and provide a calm, supportive environment. These are the last moments and so important. Administer antiemetics and promote, pro-motility agents, like if they're constipated or they're nauseated, give them those medications, keep them comfortable. As ordered though, if they're ordered. If not, then we can contact the physician and get a prescription for it. Encourage patients to lie on their side, right? It helps prevent aspiration. Increase fiber in the diet if appropriate. They might need stool softeners or laxatives. Encourage the patient to eat small, frequent meals or preferred foods, but never force them to eat. Let them make that decision, right? Let them keep that autonomy of choosing whether to eat or not, right? So then you want to reduce the discomfort from dehydration, because they'll get dehydrated. So that mouth care, the oral care that we provide every 2 to 4 hours will keep their mouth moist. Offer ice chips, moist cloths on the lips. Keep the lip and tongue moist. Administer oxygen as ordered. Keep the head of bed elevated to promote breathing. That's extremely important. Keep the air cool in the room and check if the patient requires anything else. I'm sorry, that sentence is not finished in your slide here. Care of the body. Now when the person passes away, there are certain things as nurses we have to do for our patients who have passed away. You want to verify that the healthcare provider has certified the death, which includes documenting the time of death and the actions taken. Determine whether the patient requires an autopsy. And usually the coroner's office or medical examiner might require an autopsy, especially if it's an unexpected event. Certain things, for example, if the patient was just admitted 24 hours ago, what happened, So they're going to order an autopsy. Or if it was an accident, or if it was, a health error or medication error or something that killed the patient, then they'll, order an autopsy as well. If they're organ or tissue donor, then validate that request, because there's specially trained personnel who come and do this. They're trained to talk to the family, and they will come and they will ask the family. So if they are organ donors, then make sure you follow facility protocols for that. Identify the patient. You're using 2 identifiers. Look at the name and date of birth or medical record on the system, right? As you're doing it, you want to perform hand hygiene and apply disposable gloves, apply a gown if the risk for body exposure to body fluids is there, right? Provide sensitive and dignified nursing care to the patient and family. And we're going to practice this in providing the care, dignified care to the patient in Skills Lab. So once the death has happened, we have to document, right? It's extremely important. We want to document the time and date of death and all the actions taken to respond to it, any verification of death according to the healthcare agency, name of the healthcare provider who certified the death, people notified, who all did you call and notify when the person died, right? Name of person making a request for organ or tissue donation, and then special preparations for the body, anything that the family has requested, right? Medical tubes, devices, or lines that were left in or on the body. Personal articles left on and secured to the body, like, for example, wedding rings, things like that, because the family might want to take those, right? Personal items given to the family with the description, date, time, and to whom given. For example, if the patient had like a wedding ring on or jewelry on or something on, and if you take it out to give it to the family member, make sure you document who you gave it to, the date, time as well. Location and body identification tags, and the time the body was transferred to and what destination it was transferred to. Like, for example, if it was a funeral home, put down where it was sent to. And that is it for your PowerPoint on loss, grief, and end-of-life care. I will see you in class.